There we go. Good evening and welcome. My name is Marcy Taylor, chair of the Zeta Phi Beta sorority Stork's Nest. Zeta Phi Beta and March of Dimes has a respected and enduring partnership and legacy of addressing issues of prematurity, birth defects, and infant mortality. The March of Dimes has identified November as Prematurity Awareness Month, and the entire month of November is, we're glad to do these segments called Moms Stay Woke, where we're having conversations with young women about childbirth. And we also want to thank Nurse Family Partnerships for partnering with us. Now, this workshop is going to be taking place every Wednesday at 6 p.m. And if you attend all the sessions, you'll be entered into a drawing for some awesome swag. There's going to be some NFP swag in there. It's going to be a self-care kit. It's going to be gift cards to Generations Adventureplex, a gift card to Nailed by D, and a $100 gift card to Therapeutic Indulgence. So each week we're going to have a topic that we're going to be talking on. This week we're going to be talking about preeclampsia. Week 2 is preterm labor. Week 3 we're going to have a NICU nurse come in and talk. Week 4 we're going to have a couple of mom stories, and week 5 we're going to have support groups and programs. We're going to be talking about that. At the end, we're going to have a question and answer if anyone is curious or has questions about anything that we've talked about. Also on, we have our president. I would like to introduce Alice, if you would like to say anything.
Good evening, everyone. I'd like to thank you all for attending our session tonight. Thank you for our partnership. And I am looking forward to hearing from Marshall, a great speaker. So I'm interested in seeing what you have, my lady.
Great. Now I'm going to introduce Marshall. So Marshall Pettit is a certified doula, community health worker, lactation specialist, and program coordinator for Base Doula Services of Goodwill, Michiana. Marshall has a driven passion to help improve maternal health outcomes throughout her community and currently provides doula support to expectant parents throughout LaPorte, Elkhart, and St. Joseph counties. She is an active member of Birth Equity and Justice of St. Joseph County, FEMR, which is Fetal Infant Mortality Review, and Partners for Healthy Babies of LaPorte County, and the Diversity, Equity, and Inclusion Committee of Goodwill of Michiana. Marshall completed her undergraduate studies in Human Services and Interdisciplinary Studies from Bethel University. She is a Michigan native, but currently resides in South Bend with her husband. And Marshall is a mother of 4 adult children, 2 bio and 2 bonus. We welcome Marshall Pettit. Thank you.
Thank you so much, Marcy. Thank you guys so much for having me. Does anyone else want to do introductions? Rochelle, do you want an introduction, or the rest of your sorors, Marcy?
Rochelle, go ahead and introduce yourself. My apologies. Go ahead.
No, that's okay. So I am Rochelle Andruskevich. I am the nurse supervisor for Nurse Family Partnership in our Tri-County area that covers LaPorte, St. Joe, and Elkhart counties. I've been with Nurse Family Partnership for 3 years, so since it came to this area, and just been the supervisor for a little under a year.
Okay, would anyone else like to introduce themselves?
I see we have 2 participants, Jamila, Tamara, is that correct?
Hello, yes, my name is Tamara. I am going to be giving birth soon, December 7th. Yes, and Marshall is my doula.
Hey.
Hello.
Jamila?
I think Mila is at work, so I think she's gonna stay on mute. Mila, if you can hear, you do have an opportunity to talk. Just put your hand in the chat, and then I'll let you talk. But Mila is actually a doula also here in St. Joe County, serving the Michiana area. And I just hired Mila to work with Base Doula Services with Goodwill and Nurse Family Partnership. And she is our contracted doula. So she's working with me, and I'm her mentor, and she's already taken on 3 births for me. And so she's on fire to help reduce the disparities here throughout the counties that we serve. So I'm really excited that she's on the call today, because this girl is on fire. Thank you, Tamara and Jamila, for for joining with us tonight. So let me go ahead and dive in. I'm not really sure how many of you have experienced or know someone who was diagnosed with preeclampsia.
I know a few.
Do you know what it is?
Me?
Yeah. It's okay if you don't.
I do and I don't. I never really totally understood it, but is that when they're it's not like with the something similar with the diabetes a little bit, pre-diabetes, maybe when they're pregnant only and then their levels are kind of escalated, and it's usually just during pregnancy, but it can, like, if they don't do what they need to do and as they have the baby, it can carry over to maybe diabetes.
So close. So
Close, okay.
diabetes, gestational diabetes. So diabetes would be one of the risk factors for preeclampsia. So okay. Yes, you are on the right track. And so let me begin by saying that I am not a medical care provider. As a doula, we just offer evidence-based information, emotional support, and physical support. So everything that I offer to my clients and to the community is evidence-based research, but it's not, I'm not standing in as a medical care provider. Rochelle is a registered nurse, a bachelor prepared registered nurse. And so Rochelle, if you want to jump in at any time as I'm explaining this and you have any insider, if I explain something that's incorrect and you have some different knowledge, please jump in and share with everyone on the call. So preeclampsia is a hypertensive condition that affects pregnant women, and it usually comes on in the second part of the mom's pregnancy. So at about week 20, they are starting to notice the signs of preeclampsia, or soon after the baby's delivered. So when we talk about preeclampsia, what are some of the signs of preeclampsia? Some of those signs that are developed during pregnancy that really lead to preeclampsia or that you will notice are severe headaches, vision problems like blurred vision or flashing when you're looking at something. It's like flashing lights a little bit, vomiting, pain in like your lower rib area, and sudden swelling in your face, hands, and feet are some of the symptoms. If you notice any of those symptoms, then you need to seek medical attention right away. So either go to your local emergency room, contact your midwife or your OB, or get to your family physician as soon as possible. But you want to make sure that once you're noticing those, you want to make sure you seek medical attention right away. So although some cases are mild, the condition can lead to serious complications for both mother and baby if it's not monitored and treated. So that's why it's really, really important that if you start to notice any of those signs or symptoms, even if you think it may be related to something else, you want to seek medical attention right away, because the earlier preeclampsia is diagnosed and monitored, the better the outlook is for mom and baby. Any questions yet? So signs in the unborn baby that there may be preeclampsia is the baby will have slow growth. So this is caused by poor blood supply through the placenta to the baby. So the growing baby receives less oxygen and fewer nutrients than it should, which can affect the baby's development. So this is called intrauterine or fetal growth restriction. So if your baby is growing slower than usual, this will normally be picked up by your provider in your prenatal appointments when your midwife or your OB assesses you. Without immediate treatment, preeclampsia may lead to a number of serious complications, which may include eclampsia, HELLP syndrome, which is a combined liver and blood clotting disorder, or even a stroke. So again, we can't stress enough for you moms who know someone who's pregnant or will be conceiving that once you see these symptoms or you know these symptoms, to share them with your family members or your friends who are pregnant, or if you plan on giving birth or having a baby anytime soon. So who's affected by preeclampsia? So there's a number of things that can increase your risk of developing preeclampsia. So one of the things is, like we talked about, is it Elise?
Elise, yes.
Elise. One of the things Elise talked about was the diabetes, and that is a risk factor. So diabetes, high blood pressure, kidney disease before you're pregnant. So these things that occur that you were diagnosed with prior to your pregnancy. Having an autoimmune disorder such as lupus is a risk factor. Having high blood pressure or preeclampsia in a previous pregnancy is a risk factor. So those can increase your risk of developing preeclampsia. Also, if you have a family history of preeclampsia, if you are giving birth to multiple, so twins, triplets, quadruplets, advanced maternal age, which is 35 years or older. Yeah, that's considered old. So when we're talking about maternal health, so 35 years or older is advanced maternal age. So that puts you at higher risk for preeclampsia. A young mother being pregnant, so under the age of 18 years, is a high risk factor. Having a body mass index of 35 or more, so your weight, if you're obese, then you're at a higher risk for experiencing or being diagnosed with preeclampsia. If you have 2 or more of those morbidities, you are at increased risk for developing preeclampsia also. So if you have diabetes or kidney disease, or you have diabetes and lupus, or any autoimmune disorder, you're at higher risk for developing the preeclampsia. If a provider thinks that you may be at risk for preeclampsia, they may ask you to start taking aspirin at about 12 weeks of pregnancy until your baby is born. Usually when you go to your prenatal appointments, you're taking lots of blood work and a lot of urine tests, so they can find the preeclampsia during your urine tests. And they do that by testing the urine using testing your protein using a dipstick. So the dipstick is a strip of paper that's been treated with chemicals, so it reacts to protein and it usually changes the color. So if the dipstick tests positive for protein, your medical care provider may ask for another urine sample to send to the laboratory for further testing. Tamara, I'm sure you've had lots of testing done since you're at the home stretch here. You've probably had lots of pokes and blood tests and urine samples that you've had to give, I'm sure.
Yes, actually, I also have high blood pressure, which is one of the effects of that preeclampsia. And they did find a lot of protein in my urine early on, though. But actually, my blood pressure has been under control. And from the urine sample that or the 24-hour urine that I collected, I don't have it. So fingers crossed that we just progress and I can make it full term and deliver a healthy baby.
Yay.
Yes.
I'm glad she mentioned that 24-hour urine, because I was going to say that's one of them that they do. If there's concern, they'll collect every urine over 24 hours and look at the protein level in that. So
that's really important to know too. So
Marcel, I was interested. I mean, it was quite interesting. I was taking some notes when you said some of the signs. And when I listened to the signs, that's a lot. It's kind of like what we all go through anyway. So and when you said the 20 week mark, is it generally, have they been earlier than that? I mean, because the signs, when you talk about the headaches, the vomiting, the vision, the swelling of the hands and feet, you know, a typical pregnancy involves a lot of that. So it's just kind of like women can really miss those, you know, I ain't gonna say the diagnosis totally, because if they're doing the urine test and things of that nature, but it just kind of sounds everything that kind of like is thrown together and it can go in a different category. So it's kind of like really scary. Like if you do get to that point where Lauderdale talked about, yes, my urine was positive and, you know, this and this and that and that, you know, it's kind of like, whoa, which way do I go? Because I've been having this, it's no big deal. Why I need to see the physician regarding these symptoms.
Yeah.
So I thought that was pretty interesting when I was taking my notes. So
Yeah, it is. I'm glad you mentioned that, because there's a few things in that. So a lot of times, so we talk about the urine samples that are being taken and the blood tests are being taken during your prenatal visits, and we're talking about the onset or the diagnosis being at about week 20. Well, some of our moms don't have prenatal care. So they don't go to the hospital until it's time to deliver. They're going to the ER, and a lot of times they're already in labor. So we're missing that. There's a gap right there. So that increases the risk for adverse maternal outcomes, so death, and even infant death, not just a maternal death, but an infant death. And so it's really, really important that we really talk to our moms. And it has a lot to do with, we don't want to get into legislation and all of that, but it has a lot to do with our laws and policies. When moms can't, we say we want moms to go in for early prenatal care, but if they're having state funding for their Medicaid insurance and they can't get into prenatal care, how do we combat that? So that's one of the things that is really one of the reasons why we really love partnering with Stork's Nest, is because you guys have an eye too for preterm babies, and you have an eye for moms who are pregnant. And so the more eyes we have on our moms in the community, and the more we partner with one another and we connect to these organizations, the more that we can have these resources out here for moms. And so if moms are not connecting to providers due to a lack of insurance or due to transportation or whatever, we can work together and we can help mom get the care that she needs. So these things can be identified. And so we do help alleviate some of these issues. So and a lot of especially our African-American moms, they're already coming into a pregnancy with hypertension, with diabetes. So we already know that we are at higher risk for these comorbidities in our community, in our culture. So you're right. Some of them are not being identified because it's something they deal with every day. I had a mom recently, she was 23, I think, and she's had high blood pressure since she was 18. Another mom, she's had high blood pressure since she was 12. So if you've had it for all those years and then you become pregnant, you're already immune to the symptoms. So you don't even know that's happening unless you're going to the doctor and that doctor is monitoring those things during your prenatal visit. So I'm glad you brought that up, because that's another thing that we really, really need to keep eyes on in the community, which another reason I'm such an advocate for nurse family partnership, because we do that. Our nurses go out and we help monitor those symptoms with our clients. And so we're able to help them get the resources and get connected to a provider if those things happen, because you're right. Some of those, they're missed, and if they're young, they don't know. They think they're just having a headache they don't know it could be due to preeclampsia.
Can I jump in for just a second?
Yeah.
Okay. So a couple of the things with the symptoms that you pointed out specifically, Elise, is the headache is typically a headache that's not relieved by pain medication. So, we can only take Tylenol during pregnancy. And a lot of people, that doesn't do much for them anyway, but typically that's what we stress, is it's a headache that's not relieved by resting or taking Tylenol. Swelling, while it is a symptom, it's not used as like a primary symptom anymore, because swelling is something we deal with in pregnancy anyway, but it's more that sudden swelling. So maybe you haven't had a lot and all of a sudden your fingers are like sausages. Mm-hmm. So that really sudden swelling. We also look at weight gain, and then the blood pressure is a huge indicator. So typically you're not going to have preeclampsia without having that elevated blood pressure as well. So that's why they're checking that blood pressure at every visit. They're doing that urine at every visit. And with nurse family partnership, we're seeing them in between those doctor visits. So we may pick up on that sooner than the doctor will, because we're checking that blood pressure, we're checking a weight, and doing those hands-on assessments in between their OB visits. So yeah, thanks.
Thank you, Rochelle. That's really good information, because you're right. The weight gain and the headaches that don't go away. The young lady that I just supported for the birth, who she was having, her headaches were so bad, she was going to the ER like two times a week. And, the hospital called me to come see her as her doula. So I drove to the hospital to see her, and she couldn't even walk. They said when she came in, she was holding her head and she was just stumbling. Her blood pressure was so high. It was like almost 200. over like 160. She was at stroke level, but it's been like this since, you know, she was like 18 years old. So she's thinking this is normal for her, you know, but I mean, and that's with taking three high blood pressure meds per day, and it's still that high. So, you know, just some of these symptoms we just really need to be cognizant of, and we really need to pay attention to our bodies. And even when we have family members who are pregnant, we can kind of tell when there's something off a little bit. So just taking notice of those things and keeping a close eye on those who are with child. So if you're diagnosed with preeclampsia, you'll be referred to a specialist right away to be monitored. A lot of times you'll go to the hospital and you'll be closely monitored in the hospital, and they'll determine from that point if hospital admission is necessary. The only way to cure preeclampsia is to deliver that baby. So you'll usually be monitored regularly until the baby is delivered. Normally around week 37 or week 38, they're going to schedule an induction. Depending on how severe your preeclampsia is, they may schedule an induction prior to that. While you're in labor, they will give you medication to monitor to lower your blood pressure. Although most cases of preeclampsia causes no problems and improves soon after the baby is delivered, there is a risk of complications for both mom and baby if it becomes very, very severe. You have anything to add to that, Rochelle? Rochelle has lots of knowledge because she's worked in labor and delivery.
The only thing that I was going to add is that it can actually develop after delivery as well. And so there's another benefit to Nurse Family Partnership. We're doing weekly visits with moms after they deliver that baby for about the first 6 weeks. And we actually had a nurse catch a client who had postpartum preeclampsia. She went for the visit. The client was complaining of headaches. She had severe swelling. Blood pressure was through the roof. They called the doctor, and the doctor was like, "Oh, you have an appointment in the morning. We'll see you then." And the nurse encouraged her to go to the ER, and she ended up being readmitted with postpartum preeclampsia. So just another little nod for our program and having nurses visit in the home. So
yeah, thanks, Rochelle. It's really important. And it's really beneficial when you have that extra set of eyes. So just imagine if she did not have a nurse looking out for her, and she would have stayed home that night with her blood pressure skyrocketing. I mean, that's and a lot of times, and I remember that client, and she did call the provider, and the provider told her to wait until she comes into her appointment, and some things are emergent and you can't wait. So and again, that's what I was getting into next is the condition. The preeclampsia can develop, not as common, but it is common, develops for the first time within 4 weeks of mom's being discharged from her birth and delivery. So if that happens, you'll need to have your blood pressure monitored regularly. And once you leave the hospital, and you will continue to have it, or you should continue to have it monitored and begin taking medicine. A lot of times the provider will normally put you on medication to lower your blood pressure. After your 6 weeks postpartum visit, they will continue to monitor you to see if your blood pressure goes down, and to see if they can reduce your meds or take you completely off the meds. So usually at your postnatal appointment, 6 to 8 weeks after your baby is born, the progress of your preeclampsia should start to decline, or your preeclampsia should start to decline or go away. And if it doesn't, then they will continue to keep you on that medication and continue to monitor you. And then again, a lot of times that 6-week postpartum visit is not the visit for the preeclampsia. So they can be 2 different visits. So oftentimes, if you have the preeclampsia, they will your provider should see you prior to that 6 weeks postpartum visit. If they don't schedule that visit, you want to call after you're discharged from the hospital. You want to call back to your provider, and you want to schedule a visit to be seen prior to that 6-week postpartum postnatal appointment, just to make sure that those your hypertension is not, your blood pressure is not still elevated. You want to keep a close eye on that. Any questions? You want to add anything, Rochelle? Okay, that's all I have for.
I did actually have a
preeclampsia.
question.
Oh, go ahead, Tamara.
I was gonna say, so like in my case, it's just a quick question. In my case, since I haven't had any issues necessarily with my blood pressure, is it possible that I could also have preeclampsia, but it's just under control? Because I've been taking medication since I was 22. I'm 28 now, and it's just always been under control with the medication. So I was wondering, is there a way that, but I haven't had any other symptoms that you guys have described tonight, but I was just wondering, is that possible?
The short answer is no. With the lab,
Okay.
so they do lab work and they look at that 24-hour urine, and those are the major indicators. Like, so regardless of that blood pressure being under control, if you had preeclampsia, there would be lab markers that they would see. And I've
Okay.
been out of the hospital for a few years, so I can't tell you exactly what those labs are anymore. But yeah, they look at different lab work and that 24-hour urine, which is that final, yep, this is what this is.
Okay. Alrighty.
And I'm sure, Tamara, they're closely monitoring you when you go for your prenatal appointments anyway, because you have hypertension and because you've had that, that scare of the preeclampsia. So I'm pretty sure they're keeping close, and your doctor's pretty good at that too.
Yeah, and I go for stress tests every week.
Yeah.
So
it should be identified if there is any issues.
okay. Thank you guys.
You should be in the clear, girl.
Good.
Is this your first pregnancy, Tamara?
Yes, ma'am, it is.
Oh, wow. Congratulations.
Yes. Thank you.
And when is your due date again, Tamara?
December 7th.
December 7th. Okay. And also we have someone else on, Dorisha Williams. Would you like to introduce yourself?
Hello. Yes, I am Dorisha Williams. I got on a little late, so forgive me. This is my first one also, and I am due January 8th.
Okay.
I think there's someone else on here, Marcy. Dorisha, it's good to meet you and congratulations on your pregnancy.
Thank you.
We have two other sorority members, Angela Forrest and Cassandra Hill. Did I miss anybody else?
Nope, that's it.
Okay.
Hi, y'all.
Hey.
She still has the picture of her thinking. Oh, there she is. She is real.
Hello.
I exist. I'm real.
Well, I tell you, this is a lot of information, and I know I mix them all up over the years that we've had different ones, and even from when we used to do face-to-face sessions with the March of Dimes. A lot of our literature has changed over the years in the format that the sorority has done over since prior to the pandemic and during the pandemic. So the partnership with some of the March of Dimes has changed some of our literature in the way the educational piece is introduced into to the community with participants. So it still feel like I'm just learning it all new again. Like I said, I'm mixing them together. My children are adults, and so is Angela's and Marcy. So it's been a minute since we been through pregnancy. So it's really nice to be able to be refreshed and be able to pass this information as resources on to the ladies in the community. So we definitely appreciate both of you guys' time and the partnership that we have with NFP. So Marcel, like I said, you've the few times that I've been on and heard you, you've always been a marvelous guest speaker. So I appreciate your time as well. I'm not for sure what else Marcy has planned, but I did wanted to acknowledge both of you and to our participants that are on this evening. Thank you for your time.
Thank you so much, Elise. I appreciate that. And listen, my babies are grown too. I've got 20s and 30-year-olds. So And I tell all of my clients, if it's every time a mom, whether it's her first birth, second birth, 10th birth, every time a baby is born, a mom is born, she's reborn. And so information changes, the medical field, medical technology advances. And so, like Rochelle said, she hasn't been in the hospital bedside for 3 years. Pretty much probably everything has probably changed from 3 years ago. So even though our diseases and everything that's going on in our body is the same, everything around us changes. And so I haven't been in a birth room for 29 years. So everything is 24 years. 24 years. So nothing is the same. I learned something new with every birth I got 10.
And yeah, I've got kids at both ends of the spectrum. I've got a 21-year-old, a 20-year-old, a 4-year-old, and a 2-year-old. Yeah.
So Rochelle would know. She's the one who would know what's going on in the birth room because she has the smallest baby.
And you know what? I can honestly say being at the bedside as a nurse and being the patient are totally different. My last one was a C-section, and I'm like, I got this. I've been in the room so many times. No worries. Yeah, no. Totally different when you're the patient.
Yeah, yep, it is. Rochelle, thank you so much for sharing your expertise, and thank you guys again for having us. We really appreciate partnering with you guys, and we're looking forward to next week. Is it next week? Yeah, next Wednesday?
Yes, every Wednesday in the month of November from 6 to 8. So next week, we're going to talk about preterm labor. Week 3, we're going to have a NICU nurse come in. We're going to have a couple of moms tell their stories. Week 4, we're going to talk about support groups and programs on week 5. Once again, I just want to thank everyone for participating. Marshall and Rochelle, thank you for your information and your insight. And for our participants, we hope to see you next week. If there's no questions from our participants, we are good.
Thank you so much. Thank you for everyone coming on. Go ahead.
Yeah, I was just going to give a quick reminder, since Dorisha joined a little bit late, that if you attend every session, at the end, you'll be entered to win our gift basket. So
Thank you.
Very nice.
And if you win, then you get that therapeutic indulgence gift certificate. You can pass that to me for Christmas.
Marcy, can you repeat what's in the basket again?
We have some NFP swag. We have a self-care kit. We have gift cards to Generations Adventureplex, a gift card for a manicure at Nailed by D, and a $100 gift card to Therapeutic Indulgence.
Oh, wow.
Yeah.
Tamara, come on to attend the next 3 so we can split the gift card.
I'll be here. I want to get as much information as I can, so I'll definitely be here.
Okay. All right, you guys. Thank you so much for your time tonight. I'm going to end the call.
Thank you. Have a great night, everybody.
Thank you. You too. Bye-bye.
Bye-bye.